This is Heart of the Matter.
Thanks for joining us today. I'm Cody Holmyoke. Right now, we are watching the impact of a decision affecting millions of Americans, one with real implications in Kansas and Missouri. It all has to do with the president's tax and spending bill signed into law earlier this month.
And it includes the largest tax cut in American history, the largest spending cut, $1.7 trillion, and yet you won't even notice.
This sweeping legislation extends massive tax cuts from 2017, increases defense spending, and sets aside about $170 billion for border protection and immigration enforcement. That's more than the past three administrations combined. It also phases out several key energy incentive programs from the Biden administration. The biggest controversies and reversals surround the removal of benefits for millions of Americans. This new law makes significant cuts to SNAP or food stamp programs, as well as Medicaid, which provides health coverage to low-income adults, children, pregnant women, elderly adults, and people with disabilities. It's $1 trillion in cuts over 10 years. The nonpartisan Congressional Budget Office estimates some 11.8 million people will lose health insurance over the next decade because of the changes, which include more stringent reporting and work requirements, more out-of-pocket costs, and funding changes for providers and enrollees, which we'll get to in a moment. These new policies are expected to add more than $3 trillion to the national debt. For those couple of reasons alone, this was a hard sell in Congress. It barely passed. No Democrats voted for it, and many Republicans either held their tongues or changed their tune, including Missouri Senator Josh Hawley, who in May told reporters he didn't want to cut Medicaid benefits.
I continue to maintain my position. We should not be cutting Medicaid benefits. We are struggling with rural health care coverage. And, Republicans, we need to be making that better, not worse.
The senator then voted for the cuts after striking a deal to provide compensation and health care for survivors of radiation-linked cancers around St. Louis and St. Charles. He also says he secured the delay of Medicaid cuts in Missouri. Other Republican lawmakers, including Kansas Senator Jerry Moran, also worked to strike deals to make the bill more palatable before passing it. He says he, too, secured a one-year delay of drops in state-directed payments to help providers adjust and pushed for the creation of a $50 billion fund to help rural hospitals facing significant financial challenges. Many critics are worried about the larger implication of these cuts.
There's a ripple effect. A lot of people from rural areas will go to their local hospital in an emergency, but they might be driving a little bit farther to get to a major metropolitan area for specialist care and what have you. So all of these things are related.
Advocates are also concerned these changes will make it harder for people to enroll in health care, and they're worried about what a lack of funding will mean for providers and health systems moving forward. Let's get to the heart of the matter affecting your health. Jaron Rabin's president and CEO of Swope Health, which provides health care for thousands of patients here in the metro. Thank you for being here, talking about such an important topic here. We know Swope Health has a number of locations in Kansas and Missouri. How many of your patients are on Medicaid? How much will this affect?
So it's roughly 40%. A little over 20,000 patients.
Wow.
Receive Medicaid.
40%. What are you telling them right now?
Well, we really try to focus patient time on their medical diagnoses and challenges like that, but we're certainly talking to them about how we can be proactive about keeping them on Medicaid, some of the work requirements and other things that they would have to undergo. We're trying to make sure that we facilitate and help them with that. But also we want to make sure that they know that regardless of if they're on Medicaid or not, if they're uninsured, that should not prevent them from coming back to us and seeking care, right? We have sliding fee scales and other ways that we can pay for that, but we certainly know that and anticipate that patients will just decide to forego some of it if they believe there'll be some added costs.
You bring up a good point. You want people to come. That's right. and be cared for. Do you think that hearing about these changes and hearing, it's just going to be harder to get on Medicaid is going to maybe get people to not want to come to the hospital and be treated and go through all that?
No question about it. I mean, we've kind of seen this movie before. There were Medicaid cuts 2005, where 100,000 people lost Medicaid in Missouri. You'll find that the red tape, the administrative tape, the time tax, as they call it, was going to prevent some folks from coming in, right? And keep in mind, the population that we're talking about is a single person that has a average income of $21,000. That's about $10 an hour. Or a family of four for $44,000. And it's easy to say there's a lot to deal with. There's a lot of things that you have to do. And so you might put this at the back burner and decide not to engage healthcare at all.
There was a recent study, or new estimates came out from the Center for American Progress, estimate some 75,000 Kansans and 210,000 Missourians could lose their access to health insurance coverage because of this new law now. What does that do to your healthcare system, your ability to help people?
Sure, great question. I mean, it certainly has a bottom line impact, right? Our goal as a safety net health system is to provide care to anybody who walks in the door, but we have to have resources to do that, right? In order to expand services and add new offerings, add new doctors, add new nurse practitioners, individuals who can help us provide good clinical care, that takes resources. So, I mean, we're looking at a $5 million to $12 million annual hit after this bill passes.
Does that mean laying off doctors and nurses, or does that mean staff reduction?
We certainly hope not. It is going to be quite a bit tighter than it was before. We're going to make some decisions. We're going to make adjustments as need be. But our goal is to not impact patient care. But I have to be honest with you, it's not like that's not off the table. We'll kind of cross that bridge when we get there. But certainly it's going to impact the way we do services and how we do services.
What's your single biggest concern right now?
Higher uninsured, right? Missouri has been the most insured it's been in the history of the state since the passage of the Affordable Care Act and then expansion of Medicaid. We're seeing that rolled back quite a bit. That's A. And B, finances, right? Making sure that we have a strong safety net health system that can continue to do things for the populations that we serve.
You mentioned the extra hoops that people might have to jump through when it comes to work requirements, more paperwork, and at least starting the conversation about how to navigate them through that. How do you do that? What's your biggest piece of advice moving forward?
Stay diligent. I mean, people are often kicked off Medicaid for the smallest things. Wrong address, mail delayed, right? These are things that can happen to anybody, right? Regardless of if you're on Medicaid or not. But certainly those things are going to cause some challenges. The biggest piece of advice is stay diligent, get your paperwork in terms of work requirements, your eligibility requirements, the right address, right name. I mean, people can be kicked off for the smallest things as an initial being off, right, on their name. So we want to make sure people are just paying very fine attention to the details to ensure that they're still insured.
Does that mean outreach too, to try to proactively?
It does. It does. I mean, it helps us to make sure we're helping patients. So our outreach and enrollment team will be helping facilitate some of these conversations, making sure that patients are being diligent about these records and things that they have to turn in.
All right, we'll keep it there for now. Jared Raven with Swope Health, thank you so much for all you do.
Thanks
for your time.
Appreciate it.
To stay up to date on these changes to benefits and to renew your coverage or enroll, you can go online to Medicaid.gov.